Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to go over how to decrease stiffness in your knee, either before or after knee replacement surgery. Before I jump into that, be sure to hit the subscribe button, turn on the notifications so you can catch all of our videos. So before I share some exercises and some techniques, I just want to go over this 5 or 6 main bullet points or recommendations that I always give people. So the first one is you want to focus on intensive physical therapy, intensive home exercises early and often after your surgery. So really working up your volume, how many sets, how many repetitions, how much time you're spending, and rather than focusing on absolute max intensity. It's much more important to build some consistency with your exercises, with your other techniques, than going absolute max intensity, which can actually exacerbate your symptoms further and possibly increase the stiffness in your knee. So focusing on lots of times, again, we want to focus on straightening, extending the knee, as well as bending and flexing the knee. Sometimes we hyper-focus on bending or flexing and neglect making sure that we can get that knee perfectly straight as well. So really focusing intensive exercise, building that consistency. Some other tips are stay on top of your pain. So this is with pain medicine as prescribed and recommended from your surgeon and healthcare team. It's utilizing other modalities such as ice, also heat, you're welcome to use. Sometimes people try contrast therapy where you're doing heat, then ice, then going back to the heat. So you're alternating heat and ice is a great pain management strategy, helps to decrease that pain and thus decrease some of that stiffness and discomfort. And also just other techniques, elevating the legs, sometimes compression wraps or compression garments can be utilized. And all these things, if you're managing the swelling, the pain, the discomfort, you're in turn going to help manage that stiffness as well. Again, we talked about with the exercises focusing on consistency, finding that happy medium, not going to your absolute max every time, but also doing enough that you're getting that benefit. Some other things to think about are trying a variety of exercises in a variety of positions. So try exercises laying on your back, try them in sitting, try them standing. A lot of times you'll find that one position seems to work better than another for whatever reason. And mixing it up is good too, just because it keeps your, for lack of a better way to explain it, keeps your knee and keeps your body on its toes a little bit. So it can't get used to or get too apprehensive of being in one position, because you're going to switch it up and start doing some range of motion, some stretching exercises in another position. So those are the really big main factors. So another great way to help manage pain and discomfort and in turn help with stiffness is massage. So the easiest thing you can use is just using your arms and your hands and massaging with your hands and focusing on all that soft tissue, those muscle bellies around the knee joint. So of course you have your big quadricep muscles of your thigh, you have the back of your thigh, your hamstrings, and also of course your calf muscles. So using your fingertips, maybe putting a little bit of lotion on your hands so you can smoothly move them and glide them. If you have a good friend or a family member who can help, just some gentle massage to promote some blood flow is going to help with pain management, and it's going to help with pain, with knee stiffness as well. If you don't want to use your hands, a couple other options here. So we have a ball. So a tennis ball is great, especially early on when you're a little more sensitive, have a little more pain intensity. You can do it just using your hands, sitting or lying down, rubbing again throughout that soft tissue. You can also do it by putting your weight. So example, putting the ball under your leg and using your body weight and the weight of your leg to massage. For example, you can do it in your calf or come up into your hamstring. So a ball is a great option as well. And then also any type of dowel or stick, or a great thing from another YouTuber is a rolling pin. Actually works really well. And so again, focusing on those soft tissue areas. You can also get a massage stick at most drug stores or online. And just again, going the outside, the inside of the thigh, your quadriceps, get the back, your hamstrings, work on the calf as well. just gentle massage techniques is a really great way to decrease stiffness, decrease pain, and help that knee move better and help you tolerate things more. So now let's talk about and demonstrate some of the different exercises that you can do to decrease knee stiffness. So these are going to sound fairly familiar and probably look very familiar to a lot of people, but really they are the best options and exercises you can do. There's really not a silver bullet when it comes to the absolute best exercise. Again, it's focusing on that variety and doing lots of repetitions. So first one is quad sets. So with your legs out straight in front of you, and I like to put a little towel roll where you can put a pillow under your heel, and all you're going to do is push your knee down toward the mat or the surface that you're on. You should feel your quadricep muscles contract and tighten up. Hold that for maybe 5 seconds, 10 seconds, and then just let it relax, let it come out of that position a little bit, and then go right back into it. This one, again, it shouldn't be excessively painful, but you really want to focus on trying to get that knee to 0 degrees to perfectly straight. Hold it for 5 seconds, and then relax. Usually I'll do about 10 repetitions of that, and sometimes do 1 set or 2 sets depending on the rest of the exercise routine. So those are quad sets. Another option, lying down, are heel slides. So you can do this just with your leg. Again, sliding your heel as you bend your knee up. I like to get to where you find that sticking point and just try to push into that an extra little bit more. Hold for a few seconds and then just relax back down. So there's kind of 2 ways you can do this. You can just do these smooth, a little bit quicker repetitions, or you can try to really get to that end range, really get to that max amount of flexion and push into it and hold it for 5 seconds, 10 seconds, and then relax. Again, both of these can be beneficial, and I would recommend fluctuating and trying between the 2 of them to keep up some variety with your range of motion. If you have a stretching strap, if you have a rolled up towel or bed sheet, you can put that around the ball of your foot. And then as you do that heel slide and you get to your max amount of motion, you can give a moderate intensity pull, try to get a little bit more flexion, a little bit more bending, and then let it relax. So just to add and get a little bit more range of motion out of this exercise. One more good one lying down is going to be for flexion and extension. So you're going to bring your knee or your hip up toward your head and actually hug underneath it with your hands. So grasp underneath around your hamstrings. And then all you're going to do is try to straighten your leg all the way up toward the ceiling as far as you can. Unless you're super flexible, you probably won't get perfectly straight. There are some people who can, but you probably won't be able to, especially after surgery. And then slow and controlled, let the knee bend, let it flex as far as you possibly can as well. And you're just going to alternate back and forth. Do about 10 or 15 repetitions, both up and down, nice and slow and controlled. Again, a great way to get a stretch and work on your range of motion, decreasing knee stiffness. Now we're going to switch it up and show you a couple exercises you can do seated. So now in a seated position, 2 real easy exercises. One, sitting up at the edge of the chair. All you're going to do is straighten your knee up as high as you can, slow and controlled, let it come back down. You can add ankle weights to this, but really that's more for a strengthening benefit. Right now when we're focusing on trying to decrease stiffness, just doing this motion, getting some quadricep activation, straightening the knee is going to be beneficial. 10 or 15 repetitions at a time. And then also seated up at the edge of your chair, we can do some heel slides or some knee bending from the seated position. So start with your leg a little bit out in front of you. Doesn't have to be perfectly straight. You're just going to slide your leg, slide your foot all the way back. If you have a chair that hopefully you can go under it, you can even slide back underneath. and then just let it relax back out. Just like with the heel slides lying down, you can do just some nice, quick and easy repetitions, just going in and out, nice and smooth, or you can really get back to that maximum point, try to hold it for 5 seconds or 10 seconds, and then let it relax back out. You can also use your opposite leg to push in to give a little more knee flexion or bend at that end range, and then just let it slide back out. So 2 real easy exercises in a seated position, and now let's show you just a couple exercises for knee stiffness you can do in a standing position. So in standing, there's a few exercises you can do to help with the knee stiffness. One is standing knee bends or knee flexion. So standing with support, you're just going to bend your knee, bring your foot back toward your bottom, and then let it come back. Just doing some standing knee flexion or hamstring curls. Again, about 10 or 15 repetitions at a time. You can also work on knee straightening. So the best way to do this is with TKEs or terminal knee extensions. So all you're going to do is start with your knee a little bit bent. You're going to push your knee back till it's perfectly straight. Hold that for a second or two and then relax. Push back, feel those quadricep muscles activate, and relax. There's 3 positions you can do a TKE or a terminal knee extension. So you can do it with the leg you're working on back behind you, or an extended position. You can do it with your leg in a neutral position, or you can do it with the leg flexed or in front of you. Pushing the knee back till it's straight and then relax. Another great exercise I like to do are, I call them step up lunges. So you put the leg that you want to work on up on the step, and all you're going to do is you're going to lunge forward. So try to keep your foot flat on the step and shift your body weight forward or lunge forward. That's going to bring some knee flexion. Hold it for a few seconds and then relax back off of it. Push forward and then relax. As your knee and range of motion and stiffness improves, you can go up. If you have a staircase, you can go up to a higher step. So for example, this is a much higher step. You would probably progress to about here next, but just to show you, you can get your leg up and again lunge your body weight forward and come back off. So using your body weight to push into that knee flexion, and you can do repetitions or you can hold it and then relax. So those are just a few standing exercises, and I just want to wrap up this video by sharing a few things that if these conservative physical therapy techniques are unfortunately not beneficial, what are your options at that point? And I just wanted to end this video with a few more alternative options. So if the intensive home exercise and physical therapy does not work to relieve your knee stiffness and discomfort and range of motion deficits, then there are some alternative options. So one thing I'll have people look into is getting a range of motion machine or device. So there's a handful of different ones out there, but really they're just different mechanical devices that sometimes you can get through insurance or you can rent that work on holding your knee in these prolonged positions to increase your range of motion and decrease that stiffness. If you're continuing to have issues, there's also the option of an MUA, or a manipulation under anesthesia. This is where you, again, go under anesthesia and your surgeon and his team will actually manipulate your leg, perform some joint mobilizations, some manipulations to break up scar tissue, break up any adhesions that are in the knee and around the knee joint, and ideally increase your range of motion. And then after that, you would have intensive physical therapy, range of motion stretching exercises to regain and continue to maintain whatever new motion they can get you through that surgery. There's also the option of debridement surgery, going in surgically, arthroscopic surgery, and getting a debridement if there's excessive scar tissue as deemed by your surgeon. And of course, the last resort would be actually getting a revision knee replacement surgery. So hopefully with the intensive rehab, some of the management strategies and techniques that I provided in this video, you can avoid these kind of last options, but I did just want to finish the video by sharing those last couple of options. So thank you very much for watching. Please be sure to hit that subscribe button again, turn on the notifications, hit the like button to spread this video to other viewers. As always, please leave your comments and questions below as I get back to every message I see. Thank you for watching.